I have in front of me, Madam President, a Senate calendar that indicates the days that we are scheduled to be in session for the remainder of this cycle up until when we do the state budget, hopefully the end of June. And we're whittling away the days, we're whittling away the time. We're now left after today with only 39 more days that we are expected to be in session. Now, the hope will be, Madam President, that in these 39 days, we will be able to achieve what some thought would be the impossible, but is in fact really now as the time to achieve that thing, to achieve that reality, and that is trying to find health insurance for our 767,000 Pennsylvania adults who have no health insurance. We're at 39 session days on the calendar, Madam President. I look at the calendar and see that today, February 12th, which 12th happens to be the birthday of former President Lincoln. Tomorrow, February 13th, we're not in session. We then go into budget hearings, and they're scheduled to come back into session on March 10th. Now, back in November, December of last year, Madam President, my good friend and colleague, Senator Fumo, in one of his floor remarks, finally said that wouldn't it be a great Valentine's Day gift if we could provide a package of legislation that provides for coverage for health care for the 767,000 Pennsylvanians who have no health insurance. Wouldn't it be a great thing to get done by February 14th? We checked with the administration, and they said that even if we were able to get that significant feat accomplished in that short amount of time, we could probably get coverage and a program in place prior to summertime, prior to the advent of summer. We could do that. But now we're in a situation where that feat has not been accomplished. We have not been able to achieve that legislative victory, and consequently, again, 767,000 Pennsylvania adults, most of them are women, most of them are working, most of those women raising families, don't have any coverage. They're left wanting. They're left looking for help, looking for health care, looking for service, looking for treatment, making decisions when to go to the health care system, which usually winds up being, Madam President, the emergency room. That's what they wind up doing, because we have not achieved this goal. Now, yesterday's comments by some of our colleagues indicated that several of our standing committees will be meeting shortly to try to achieve some kind of negotiated agreement to get this thing moving, to make this thing happen. We welcome those meetings. As the Democratic chair of the Health and Welfare Committee, we welcome the opportunity to sit down with all of the appropriate parties and try to forge an agreement. And hopefully we can get that agreement done by March 31st. We clearly can't get it done by Valentine's Day. So there is no love in Pennsylvania, at least not coming from this building, for the 767,000 adults in Pennsylvania who have no health insurance. I would remind folks, and I say this on a regular occasion, Madam President, and some people will say that, he's just saying these things so frequently that it gets a little redundant and we're tired of hearing it, but 767,000 people is 767,000 people. They're real live individuals. They're people who don't have access to a health care program. These are people who are left out there. They don't have health insurance. Their children can get health insurance, but they can't. They can't afford it. With the economy getting a little shaky, it becomes even more difficult. With the cost of premiums skyrocketing, Madam President, going up in the last, from 2000 to 2006, going up over 75% with premiums skyrocketing and wages only going up in the same period 13%. These folks, this group, is in a more difficult, more desperate situation. But there's no love for them, at least not by Valentine's Day. And we have, the governor has drawn another line in the sand, that being March 31st. Hopefully we can achieve this by that time frame. It will take a Herculean effort, but but my mom used to tell me, if there's a will, there's a way. And hopefully we have the legislative will to get this done. There are 7 scheduled days of session in the month of March, before March 31st. Hopefully we can get this thing done. We can achieve this significant accomplishment. But if not then, hopefully by the end of June. We're now down to 39 days of scheduled session, Madam President. 767,000 people go wanting. Our emergency rooms are filled by numbers of these individuals. They're getting the most expensive care that can be provided if they get care. Our premiums continue to go up, 75.6% in a 6-year period, 2000 to 2006. Wages are not matching the rise. More people are being forced into this predicament. We got an economy that requires us to step up and to be bold and courageous and do some things that are innovative to forestall any potential recessionary issues occur in Pennsylvania, which can only impact negatively on these individuals. But they wait, they have no care, and they're just hanging out there. The adult basic program is on overload, and these people continue to wait. Madam President, Valentine's Day is on Thursday. We have found no love for these individuals. They don't get a Valentine, at least not from us. And the question is, when will we act? When will we act? When will we act? Thank you.